Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We'll be talking about urethritis. Urethritis is the inflammation of the urethra, which is a multifactorial condition and characterized by dysuria with or without urethral discharge. Types of urethritis. 1. Gonococcal urethritis. The urethritis pathogen is gonococcus. 2. Non-gonococcal urethritis, identified pathogen or may be asymptomatic. 3. Non-specific urethritis, unidentified pathogen. Causes. It is based on the types. Gonococcal Neisseria. Gonorrhea. Non-gonococcal. Chlamydia trachomatis. Ureaplasma ureolyticum. Mycoplasma genitalium. Trichomonas vaginalis. Yeast. Herpes simplex virus, non-infectious causes, trauma, urethral stricture, catheterization, chemical irritants, dehydration. Pathophysiology. Infectious agents enter the urethra, usually through sexual contact or instrumentation. Pathogens adhere to the urethral mucosal epithelial cells using specific adhesins, e.g., pili in N. Gonorrhea. Some organisms invade epithelial cells, e.g., Chlamydia trachomatis, while others remain extracellular but multiply. The presence of pathogens triggers an inflammatory response, which leads to activation of innate immunity with recruitment of neutrophils and macrophages, causing the release of pro-inflammatory cytokines, e.g., interleukin-1, interleukin-6, and tumor necrosis factor alpha, resulting in mucosal edema and increased vascular permeability. Ear inflammation leads to epithelial cell damage, ulceration, and increased mucus production. Signs and symptoms of urethritis. Burning on urination. Frequent urination, anal or oral infections, urgent need to urinate, bloody discharge from the penis, blood in the urine, yellowish discharge, itching or irritation around the opening of the penis, and lower abdominal pain, painful sexual intercourse in women. Clinical evaluation. History. Symptoms such as dysuria, urethral discharge, itching or burning sensation, sexual history and risk factor assessment. Physical examination. Inspection of the urethral meatus for discharge. Palpation for tenderness or swelling. Laboratory tests, microscopy, gram stain of urethral swab or discharge, presence of gram-negative intracellular diplococci suggests Neisseria gonorrhoeae. Polymorphonuclear leukocytes, PMNs, indicate inflammation. Wet mount microscopy to detect motile trichomonas vaginalis. Nucleic acid amplification tests, NAATs, highly sensitive and specific tests for Chlamydia trachomatis, Neisseria gonorrhoeae, and other pathogens. Preferred diagnostic method for non-gonococcal urethritis. Culture. Culture of urethral swab for Neisseria gonorrhoeae requires special media like Thayer-Martin agar. Useful for antibiotic susceptibility testing. Urine analysis. First catch urine sample for NAT. Microscopy for leukocytes. Management. Symptoms of urethritis spontaneously resolve over time, regardless of treatment. Administer antibiotics that cover both types. Regardless of symptoms, administer antibiotics to the following individuals: patients with positive gram stain or culture results, all sexual partners of the above patients, patients with negative gram stain results, and a history consistent with urethritis who are not likely to return for follow-up and/or are likely to continue transmitting infection, Antibiotics used in the treatment of urethritis include the following: azithromycin, ceftriaxone, and cefixime, ciprofloxacin, ofloxacin, doxycycline, and moxifloxacin. It's important to remember that you're not alone in this. We have various support systems in place to help you through the recovery and management process. That's comforting to hear. I was a bit worried about how to manage everything, not just the medications. We have counseling services available and group sessions where patients share their experiences and support each other. Would you be interested in attending one? Yes, I think that would be really beneficial. Thank you for suggesting it. Keeping thorough documentation helps us track recovery and effectiveness of treatments. It's a crucial part of providing high-quality care. As we wrap up today's session, remember that understanding and addressing urethritis involves a collaborative effort from healthcare providers and patients alike. Continued education and communication are key to effectively managing health conditions. Before we end, I'd like to encourage each of you to consider a topic like urethritis not just as something to study, but as a challenge to improve our healthcare system. Your work and dedication can truly make a difference. I never realized there were so many aspects to managing urethritis. It's quite eye-opening. Absolutely. And always remember, the more questions you ask, the better equipped you'll be to help your future patients. Thank you for today's lesson. It was incredibly thorough and insightful. You're welcome. I'm always here to guide and to learn alongside you. Keep the curiosity alive. Flourish Nursing Academy strives to build a better world by fostering knowledge and empathy. As you step out today, carry these lessons forward to make a positive impact.